Hey YouTube, it's Marita and welcome to another edition of the Nurse Lounge. And in this edition, I'm actually doing a video that someone recommended, and she wanted to know or wanted me to talk about what is my view, or what is it like to work with men in nursing, or how are my views with men in nursing in terms of their demeanor towards us and things like that. So if you want to see what my thoughts are about men in nursing, stay tuned. All right, we are back. My name is Dr. Marita P. I'm a registered nurse. I've been a nurse for 16 and a half plus years. I'm an OBGYN well baby nursery nurse. I'm a nurse educator, associate professor, work at HBCU, and doctorally prepared. So now that we got that out the way, again, this video is strictly about my thoughts about men in nursing, and we're going to jump right on in. So when the person asked me about this particular topic, men in nursing, and my thoughts and how they treat us, or at least treat me, I really didn't know how to answer it because I'm an OB nurse. So you don't really see a whole lot of men in OB. And I've been in OB majority of my nursing career. So with that being said, I did work with one man in nursing. He was a nursery nurse in nursing in OB area. He was a nursery nurse, and he was the only male we had. And I will say it became that with him, he just became one of the girls, shall I say, just one of the girls. So we would talk about our periods, we'd be talking about our relationships and things like that with him, and he'd be sitting there in the midst of us, and he just didn't pay us any attention after a while, because again, that was just the nature of the beast when it comes to our area of nursing. We just talk about whatever. Well, nurses talk about whatever anyway. And as you all know, nursing is a female dominated profession. And so to work in OB, it is mostly female. You will not usually find a lot of men in OB nursing. Not to say they're not there, you just don't find a lot of them there. So in that particular situation, he was one of the girls. So I wouldn't say he was soft or anything like that. He was very much a man, but we just said whatever we wanted to say. And he was, he was very appropriate. He didn't talk about anything inappropriate with us. I will say that when it came to him and his care for the patients, because some people are like, well, how was he towards his patients, considering that OB is an area in which sometimes some women don't want male nurses or wouldn't think to have a male nurse. So he was very appropriate when it came to things like that. He would always, knock on the door, which we all should be doing. We should also knock on our door before we enter a patient's room. But he would also make it known that, I just wanted to let you know, are you dressed appropriately? Are you covered? Because I'm about to come in and see or check on you or the baby. So that's one thing he would do as a tactic. So if you're a male nurse and you want to know, how do I handle that? Well, if it's a situation like OB, you would just simply say, are you covered? Are you appropriate? Because I'm about to come in and check on you or the baby. Now, when it comes to postpartum specifically, I've never seen, or have rarely seen a male in postpartum. I think I've never seen them actually working there. But I will say that when it comes to our floor, we are a closed unit, which means we take care of our own. We really don't float outside of our floor much. In the situation right now with COVID, or when we have our typical situations with the flu and we have a lot of staff nurses out, then they do lift those provisions for us being a closed unit, and we do have to go out and help the other units in the hospital. I have been to the ER, I have been to ortho, I've been to med surg, I've been to different areas of the hospital to help out in times of critical situations or urgent situations like that, staffing issues. But in general, we don't have people come in to help us because we take our own call and we don't go out. But there are some times where we need help from the hospital as well. And I remember this time where, because we don't see men typically on our floor, that there was this one male nurse, and he was so cute. He was so cute. And when these women was just gawking all over this man when he came to our floor. He came to OB postpartum. And so the only thing we really had him do, because on our floor, our charting system is very different in postpartum or in OB compared to the rest of the hospital. So the rest of the hospital used Cerner, and we use Centricity, I think. So, he couldn't come down and really chart or do a whole lot for us anyway, charting wise, or take care of patients. So we just kind of delegated him to do medications and vital signs and water and things like that, which helped us out tremendously. But I will say that in general, men nurses I love male nurses. When I see male students, I'm like, yes, we need more men in nursing. I am so big about men in nursing. We need it. But in terms of me working with them personally, I would have to say, for the most part, all the men that I've come across, they love to help you. Well, at least the ones I've come across love to help me. So I don't know about all of them, but they love to help me. So naturally, in a man's nature, a man wants to provide and protect and things like that, and feel like they're wanted and needed. So I play right on into all that. I'm kind of like that damsel in distress all the time, like, can you help me do this, or can you help me do that, and show me. There's be things that we know how to do on my own already, but they want to teach. So if they want to teach me something. I've had male nurses who say, let me show you how to do this, and it'd be something I already know how to do, but I'm like, oh, okay, tell me how to do that. And you just feed their ego. So I happen to love male nurses because typically they love to teach. A lot of times my male nurses will take a nursing student over the female nurses, believe it or not. The male nurses will, when I have nursing students, they will actually take my nursing student with them and go show them things, whereas the female nurses is like pulling teeth to do that. They're like, I don't want to do that. I don't get paid to do that. Male nurse like, come on, let's go. So I love my male nurses for that, in terms of the interaction I've had as a educator, or a clinical instructor to, a staff type of situation. I happen to love that type of dynamic. But when it comes to me working actually side by side with a male nurse, I haven't had any issues for the most part. I find them to be very helpful, to be very caring, to be like, okay, I'm gonna help you lift this patient. Let's tag team. Let's do this. And honestly, if I had to pick, it's gonna sound bad, but if I had to pick, I pick hands down to work with a male nurse over a female any day. Okay. Unless we mean that female have that kind of camaraderie where we just get along and we really there for the patient. But if I had to say, okay, it's a man and a woman, who I'm going to pick? Well, the man can help me lift, turn, do all kinds of things. He's not going to sit there, and I don't want to use the B word, but he's not going to complain as much about the things that we as women complain about when it comes. We just catty and very clicky. Men don't typically do that. They're automatically, they're not well represented in nursing. So it's far and few of them. So when they do get together, I'm sure they probably, like see another nurse in ICU or ER or something like that. They probably really do get, kind of excited about seeing somebody another man. But in terms of them working in a female dominated profession, I don't think it bothers them, but I find that they like to just stay out the way. They don't want to get into the middle of the drama. And I'm right there with them, like, come on, let's go get out this drama, because I'm not here for all this nonsense that these women be doing. And this cattiness and this picking and all that. They don't do all that. At least the men that I have dealt with do not do that. Again, that's my limited experience, because of course I don't work with men in OB typically. But again, they're helpful. They love to teach, in general. They are good with, precepting and mentoring other students and other nurses. They are hands-on. They're very much hands-on. They very much know how to troubleshoot and do things. And I find that with my male students. So let me talk about the male nursing student for just a minute. The male nursing student, I love them. I love my male nursing students for the exact same reasons I love the male nurses. It's because majority of my male nursing students do not give me any problems whatsoever. I say this is how it has to be, and because men are a little bit more regimented and they're more structured a little bit to a certain degree. A lot of my men come from military backgrounds. So if they come from military backgrounds, if they're like a non-traditional student or second career type student, they are so much on point because they are used to having structure and rigor and things like that, especially if they're military. And so I love those male students because they are like, when I say this is how it has to be done, and I need you to do this by 8 o'clock, do this by 10 o'clock, do this by 12 o'clock, they have it done. I love it. Whereas my female students, of course, you know how we are as women, just kind of care, like, oh, why we have to do all this? And oh, I want to let them sleep. Nope. The male students like, okay, what's somebody need to do it by? Okay, 7:55, they already got it done and telling me about it, ready to chart. That's the difference between my male and female students for sure. But I would have to say, hands down, men, in my opinion. Now, if you all have a different opinion because you all work with men on a day-to-day basis, comment that below. What types of experiences have you had with men? Are they nice to you? Are they mean to you? Are they helpful? What would you say your thoughts or your experiences have been with the male nursing student or the male nurse? I have nothing but great things to say. I do say there's this one time in my whole 16 years, and this literally just happened probably 2 months ago in clinical, where there's one male nurse who was not really real receptive of my nursing students. And he waited till half the shift was over to tell me we needed to do something a certain kind of way when we had did it a certain way the entire shift. And I'm like, okay, why come you didn't tell us this at the beginning of the shift? But neither here nor there. He's still not the worst person I've dealt with in my nursing career. So it's not that big of a deal for me. But with that being said, he was really, the worst I've ever had. But I ain't got nothing else to say, y'all. I mean, I don't. Male nurses and male nursing students, I love them, love them, love them. If I could have, I won't say a whole class of male nursing students, but I will say that they are typically more structured and ready to do the rigor. And then in clinical, they're a lot more hands-on anyway. So they're like, okay, show me how to do this. They want to learn their techniques. They want to learn those skills. They want to make sure they have those skills fine-tuned. They want to make sure, and this is not to say that female students don't do this, because female students do this. But the video is about what men in nursing typically is. And I just added in there what male nursing students are like as well. So this is not a slack or a diss to female nursing students, because obviously I was a female nursing student and obviously I'm a female nurse. And I'm just saying I know how we can be. But them men, let me tell you, them men right there be having it together for the most part. I have had one student who, he shouldn't have been in nursing at all. He was so timid, and he went into the room shaking and carrying on. I said, look, you can't do that here. You have to, when you as a student don't put on your poker face, I don't care how scared you are, put on your poker face. Because when the patient senses that you're scared or you know what you're doing, they will quickly put you out the room. And you don't want them to do that. So you want to show them that you appear confident, even though you sweating bullets on the inside. And I've did that plenty of times where I'm sweating bullets. I have no idea what I'm doing, but the patient from my outside face would have never known that I have no idea what I'm doing, because I'm calm, cool, and collective. This student was not like that, and I had to dismiss him from clinical that day. He got an unsat that day because he was just so not doing well that day. Not doing his 5 rights in terms of medications, 7 rights, not doing his 7 rights in terms of medications. He was not wearing gloves. He was doing all kinds of things that I know he had been taught to do, and he did not do them. So anyway, that sums it up. Tell me your experiences below. Definitely like, comment, share this video with others. One thing I want to say, I've said time and time again, we are trying to get to 2,000. I am a not young, but small YouTuber. Just started 2 years ago, trying to get to 2,000 subscribers. Once I get to 2,000 subscribers, I am going to start to go live, where I will do a question and answer session. So kind of like in class with Dr. Marita P or something like along those lines, where I answer your nursing questions, whether it be how did I navigate this, like personally what my story was or what did I do, or academically or financial aid, like how do I do this with financial aid? All your nursing questions or nursing school questions or nursing questions in the real profession, specialty areas, different things like that, I will answer in those live sessions. So if you want to see those live sessions, you need to comment, share, and like these videos so that we can get the subscriber count to 2K. And if you're not subscribed, why not? It's free 99. So since it's free 99, click the button, okay? I do have other content on here. If you don't like the other content, don't watch it. It's just that simple. But the nursing content, if that's your thing, definitely, subscribe for that alone, because it's a nursing channel primarily. So definitely do that so we can get it to 2K, so I can definitely start that session or live sessions with you all and nursing students. And I will do that probably about once a week or so. So that's something to look forward to in 2021. If you don't mind, follow me on IG. The handle will be some here on the page. And until the next time, you all take care. Bye-bye.